Brought to you by Tailored Wealth, helping business leaders live their version of a rich life.
Welcome to another edition of the Making Sense of Your Money podcast, where we cut through the financial noise and help business leaders to make smart, confident money decisions. All right, welcome to another edition of the Making Sense of Your Money podcast, where we help you take control of your finances, minimize uncertainty, and maximize your wealth potential. I'm your host, Dan Pascone. I am the founder and CEO of Tailored Wealth. And today I am excited to have a very special guest. I've got with me Tom Caress. Tom is the founder and CEO of the Caress Insurance Agency. And Tom and his team help individuals throughout the country to find effective Medicare solutions. And so I'm excited to get a chance to have you on today. Tom, thanks for joining us.
Hey, thank you. Thanks for having me.
Yeah, you bet. You bet. This is going to be a lot of fun. So we've got a lot to cover. I'm really fascinated with your business and what you've been able to build. And I know our audience would love to get your expert take on some key topics. So let's jump right in. First and foremost, can you just give us like a quick 90-second overview of your business, what it does, and then tell us a little bit about how you got into it?
So, Dan, what we do is that actually my mother moved in with me about 18, 19 years ago, and I was involved with another product called Aflac, which was indemnity insurance. And I looked at her Medicare plan. My dad had died, and I thought, wow, she's paying $400 a month for a plan. She didn't know what it was. She just said my dad told her not to go off of it. And she only made $800 a month Social Security. And I said, you know what, this can't be right. So I went out and got licensed with Aetna and United Healthcare, looked at their plans, put her on a Medicare Advantage plan, same doctor she already had, saved her $400 a month, and doubled her income. And I thought, you know, if I can do that for my mom, there are a lot of people like this. And I started marketing to people over 65 and was super successful in helping people first understand Medicare, the basics, like when it started, 1965, who wrote it, what are the components of it, what kind of, if they wanted to see certain kind of doctors, or they were real healthy, or they're real unhealthy, and helping them navigate and find a plan that was good for them. And, after 65, what's more important than your health and your wealth? And if you don't have, you can't buy your health, and I have people hug me and want to fix me dinner because I put them on plans that they get access to the things they want to do and get it quicker. That's how I kind of got into it. My background was computers before this. I can't spell, but I'm really good at numbers. and so I'm able to do the same thing. After I got to a certain point, I was put on a national advisory board with United Healthcare, one of 10 agents nationwide out of 160,000 agents. So I must have been doing something right. And from that, I saw that, especially when I was able to see what the insurance companies do and how they lobby and how they go to Congress, that anybody that didn't have a Medicare trusted advisor agent that would help them openly, and they tried to make decisions themselves, just didn't have enough information and couldn't make a long-term decision, could cost themselves money and time. And that's what I try to do, is help my customers. And then from that, United Healthcare came to me at that time and said, hey, you've recruited some of the best agents by telling them about this. Why don't you become an agency? And my son and I decided to do that, and started with 5 agents. Now we have a 242 or 243 agents right now contracted. And most of them, I would say it's the 80-20 principle, but we have a lot of people that have organically or come from other walks of life and that are enjoying the fruits of their labors and are able to make a wonderful living and get to help people in their own markets.
That's very cool. I love that. I'm always fascinated by people's stories, Tom, and what kind of motivates them to get into their business. Was it that experience with your mom that kind of prompted you to build what you've built today?
Yes. I mean, before that, when I ran a Fortune 100 company in Europe, or Toshiba or Samsung, I sold big business. Right. And I thought and I was really good at it. And hiring people, understanding what kind of people that could integrate with big business, and teaching them how to present and train and help them use computers. And then getting into this business, same thing. When I decided the residuals from a business standpoint was intriguing to me, and I listened to, to Warren Buffett talk about his side of residuals, which is, basically getting something that pays you every month. And I thought, I want to do that. But at Aflac, I wanted to sell businesses. And until my mom actually moving in with me, I never really wanted to sell individual people. This was the most rewarding thing I'd ever done in my life, because I could see that I physically changed people's lives, And every year we have annual meetings for all of our customers, either as a group or individually. And a lot of times they're tear-jerking, because people come and tell me stories of what they were able to get done and how they didn't have to pay any money, and they got the best access to the doctors. And in fact, I had a guy last year that was dying, and he called me. He says, I want to tell you, you helped us 15 years ago get on these plans, and it saved me a fortune. I've had the best access. I know I'm going to die, but you've been a wonderful advisor, Tom. And I thought,
that's amazing. That's amazing. I love hearing those success stories. And, we've only been chatting for a few minutes now, but it is clear how passionate you are about what you do and who you do it for. So tell us a little bit about your ideal client. Tell us what you, your team, your agents ultimately help, who you help, and what you help them to do.
Well, most people, I have ex-NFL Super Bowl coaches, athletes, running backs, judges, legislators, world-class musicians, on and on and on. But most of them are really good in their area of expertise, right. But they know nothing of how to navigate, because they work for a company, about Medicare. And I'm able to break it down and make it simple for them, and I let them make the decision. I let them have the light turn on. I do not tell them what to do. If I haven't been able to figure out a way to educate them so that they figure out what's actually is going on, then it's probably I haven't done my job. I usually say, so tell me the most important thing that you want out of this. What is it? Is it you want to have a low-cost plan and great access, or do you want to be able to go to any doctor in the country without a referral, and money's not, an issue of paying for the premium? And then we discuss what's important to them, and then we give them the choices, and they pick. And the people that pick their own plans with enlightenment are the ones that are the happiest.
Makes sense.
And also we tell them about how to get on Medicare, so if they don't know how to do it.
That's very cool. That's very cool. And I think I've picked up on a couple things, but I want to hear from you. What makes you and your firm, you think, unique in the way that you help your clients to figure out what is the best Medicare solution for them in their life?
Well, I think there's the biggest issues for most people is they either have a doctor or they don't have a doctor they really like. And I tell everybody the key to any plan working, whether it be a Medicare Advantage HMO, a Medicare Advantage PPO, HMO POS, or Medicare Supplement, or some people call Medigap, with a prescription drug plan, is that you have to find a doctor or a medical clinic or staff that you have access to that you can get to when you need it. You never know when you're going to need it. But if you don't have that, then you need to find one. Mm-hmm. And then we need to find something that covers you while you're in that path and what you want to do. And everybody, I have many couples that have, one of them is on one type of a plan and one on the other, and they have completely different needs and wants. Sometimes they argue we ought to both be on the same thing, but usually I get them to understand what's most important for that individual. You find that out, that's when they're happy. And then the market in the last few years, there's disruption, there's change, there's turmoil in the insurance market. We just had a big change in administration, and people want to know, what can I do if I want to change? They want to be reassured that there's a path, and I tell them about that. We have a monthly newsletter. We take every phone call. We have an office staff that I said, whatever, if somebody's got a bad bill, if they can't get access to doctors, then I know where to go in a doctor group to push a button to say, hey, the doctor groups want actually the agents to come in and tell them, hey, a doctor's got a stack of referrals and they're not escalating them. And I help them do that, and I say, call me first. Don't call an 800 number where you're going to get one of 40,000 people. Call us. We know you. We can help you. We know most of the doctors in the networks, and we will find a path for you to get the best service.
Makes a lot of sense. Makes a lot of sense.
And that's how I want to be treated. I wanted somebody to take care of me, whether it be my wealth management or my golf game or my travel. I want somebody that can help me, and I think that's how we treat everybody.
There you go. There you go. Well, I know somebody that might be able to help you in the wealth management space, but if you find someone that can help me with my golf game, truly, I would love to be connected with that individual.
That's a whole different story. I got a great tip yesterday, but that's besides the point.
Yeah, I love it. I love getting the new tip. Tom, what are the biggest challenges that your clients face?
Biggest challenges, I think, is understanding, it's funny. There's a group of people out there that are very, very healthy, and they just want to keep that lifestyle, and they want simple, they want access to gyms, they want to be able to go to the doctor when they need to go, and they don't want, they want the extra benefits, but they don't want to pay a whole lot. And then you have people that have money, and they want access to everybody when they need it, and they're willing to pay for it. And then the other ones, they don't really know or care. They actually want us to pick, which we won't do. I try never to pick for anybody. Right. So I think that and so we're able to help them no matter what area they're in of those areas. And 20 years ago, Medicare Advantage plans had a very small percent of the market, and now they're like 60% of, actually like 75% of the new enrollments, but they're like 60% of the total enrollments nationwide. And there's people in the federal government that are for them or against them in every market. And some people, the Medicare Advantage is where they need to be. They need somebody talking to them. They need a quarterback before they hand off, before they go to a specialist. Otherwise, they'd be going to specialists that they don't need, using the market incorrectly. So I think, for a lot of people, they need a primary doctor, is what I'm trying to say, so that they have somebody that's can analyze, that will actually is in their best interest, and say, you know what, see a therapist, or you know what, you don't really need that. That's what's causing those issues, is not that. Maybe you ought to go on a weight management program, which most people don't want to hear that, but that may be their best thing that they need to do.
Sure. And it's clear that there's a need there for what your agents and your team provides. How do your clients typically find you, Tom? You've built such a big agency across the country essentially now. How do they find you?
There's a myriad of ways. When somebody wants to become an agent organically, they have a past history of people they dealt with. And when I first started, we do flyers. We actually have our own in-house marketing thing that we send out. We're the number one in Riverside County, California. We send out more flyers than anybody else, we've been told by the post office. But it's for agents all over the country. And so therefore we specialize. We know who's turning 65, when, and what market. If you send out 1,000 flyers, this is on the business side, you're going to get about 10 to 15 people that are going to answer that. And that's because they're interested. They want to know 6 months out, 4.5. It's the key market. And they will contact us and come to a community meeting, or they want to come on on a Zoom or a phone call. And that's how we kind of get people started. But also there are doctors that need patients, and we team up with the doctor groups or the doctor's offices. We have an agent with them that when somebody comes in and says that, you know what, I have a terrible prescription drug plan. Can you help me? No, but I have an agent will. Okay. Same thing with pharmacies. Same thing with dentists. Same thing with people that are optometrists. All those people don't understand the Medicare market. They understand how to get paid if they're a provider. But we can help them actually get more customers and get the right customers to them in the marketplace. Same thing with wealth management. We have many, many wealth management companies. I'd say a third of our agents are teamed up with 2 or 3 wealth management groups that feed them leads of people turning 65. Got it. We also have maybe 7, 8 agents that have figured out that they go to the HR people in markets where there's companies of 100, 150, 200, 300 employees. And they have people turning 65 or 65. They're on company plans. The company has to pay a fortune for them. They can't push them off, but they'd be readily well off if they were on a Medicare Advantage. They would have better insurance, and it would cost the company and the person less money. And so when we get to those, we have people that even have counties and cities that we do that for. We have agents, and those agents are unstoppable. They usually end up hiring 2, 3, 4, 6, 10 agents underneath them to help them. And so it's just, there's a myriad of way of getting the leads. I also do locally. I do radio and I do TV.
Nice.
In my market, it's not affordable in every market, but certain markets of the country are. We've tried every form of other marketing, and it's amazing. Seniors still open their mail, and you can't call them. The Medicare business doesn't allow you to call anybody directly. It's illegal. They have to call you, the customer, and then you can talk to them, and they have to agree to the relationship. But that's probably a good part of it. And then probably there's 2 other huge ways, is that once you get starting to help United Healthcare, Aetna, Humana, Scan, Blue Shield, Mutual of Omaha, Cigna, Blue Cross, and you start selling their product in a market, they come to you and say, you know what, I have more leads for you. We have people that come to us, and that we get them hooked up with the insurance companies. And then the last way, once you get a certain book of business, we have a unique way that we help agents manage their book of business, both through CRMs and through marketing, that they can double their business if they have 200 or 300 customers or potential customers just from the referrals.
Got it. Nope, that makes sense. You're talking my love language there, Tom. So I can relate to that. So you mentioned a couple different referral partnerships, and we always like to highlight that here because we've got a lot of folks in different aspects of the financial services and health industries that tune into our content. Tell us a little bit about how you or maybe your agents collaborate with referral partners. I know you mentioned wealth management. That's obviously my business, so that's near and dear to my heart. But tell us a little bit about how those referral partnerships
Well,
typically form.
yeah, I mean, I have two groups that for a long time that have been, that I actually, where I park my income and stuff. And I didn't start out that way, but they have come to me and said, listen, I have people turning 65 and they send me customers. Well, when we do a lot of newsletters, people come to us and say, Tom, what other insurance do you sell? Do you sell life insurance? Do you sell long-term care? Do you, and they start to trust you as an advisor. And so then we refer those people to the wealth management people, and it becomes a great relationship.
Yep, well, we've seen that work in our business as well, so I totally get that. Tell us a little bit about the agents that you've hired. You mentioned over 200 across the country. How have you been able to sort of build up your team? That's no easy task. Getting clients is one thing, but building up a team is a different challenge. Tell us how you've been able to do that and what's made that so successful for you.
When we first started, my son and I would go out and we found out that Farmers Insurance was cutting their commissions, and it became a struggle for the agencies. So in California, we wrote every agency and ended up signing up about 15, 20 of them. And most of them are still with us that we went and talked to them, and it was the right thing for them to do to add a product. Now, most of our new agents are family referrals, either of customers or people in the industry. I would say over half of our referrals right now come from insurance companies, as people will come to them and say, you got to go talk to Crest because they actually take care of their agents. And I mean, I had a person that runs Southern California for a major insurance company yesterday say, Tom, I'm so amazed because your agents, I know what you do, and you do more than any other agency. So we try to help them. We're not worried about the upfront money that we make. We try to spend it on the agent. My thought is, if I can get an agent in front of 30 people a month within 2 or 3 years, and that costs me all the money I make on them, they're going to make more residuals. And 10 years from now, we're all making more money.
Yep, well said. Well said. That's a good perspective to have, playing the long game there. Where do you see your industry going in the next 5 to 10 years, Tom? And how are you staying on top of that? There's obviously interesting demographics throughout the country, and what you do is such a big need. But what are the biggest challenges that you see?
Well, it's interesting. I just came back from a conference in Nashville last month. It was freezingly cold. They had the worst cold streak. Of course, I hit it perfectly. And two things. Before the pandemic, they listed how many agents there were nationwide. And there's less agents licensed today selling Medicare than there were 5 years ago. And in the next 10 years, it's almost going to go up 300% in the amount of people that are going to be Medicare eligible. So the problem is efficiency. At the end of the year, when you need to, open enrollment, when you need to meet with people, there's been all kinds of talks by the federal government of changing it. It used to be you could change on your birthday month on certain plans. And then now it's basically there's an open enrollment. October 1st to December 7th is when people can change unless they move and have all these special election periods, which you need to know in every market. But so what's happening is that you have to see, or annually, you have to figure out how to deal with those customers. And when you have 2 or 3 or 4,000 customers, you have to have an office staff, and we tell people that are agents how to do that, and then the software. So my background's computers, and we have the latest software components. When I first started, every time you enrolled somebody, it was a paper app, and you faxed it in. Yesterday, I had a unique day. Here it is, the end of March, and we had 8 enrollments, 8 apps, okay? All done over the phone. I think all of them were referrals to me personally, and we were able to, give them whatever they wanted. Some were changing. And so it's easy to do with the right software. You put the information in, they look at it, they get to look at their own information, they approve the app, and then they submit it. It goes straight to CMS, and then they're in there. So automation, the same thing on customer service, the same thing on we have some survey software that goes out in August or September. Has anything changed? If it does, it goes back into the customer database. It updates it. So when open enrollment comes, we can run a list. Hey, this company is pulling out of a market in Missouri. And everybody that we have in that market, we can contact them October the 1st saying, hey, your plan is ending or changing, and let's get together and set up a time on calendar that we can go ahead and discuss what your choices can be and what you want to do in the next coming year. So automation, efficiency, and then I think you still have to take the time with the customer. And the people that don't do that, a lot of younger agents or agents that have not succeeded basically want to enroll. They want the upfront money, and they don't really want to take care of customer service. They refer them to the insurance company, and then you might get somebody in the Philippines. You might get somebody that brand new hire that's going to give you the wrong information, and that's a shame.
Makes a lot of sense. Makes a lot of sense. Thank you for sharing that. All right, so we're going to shift gears a little bit and talk a little bit about you now. But I have one question before we get to our lightning round, which we have a ton of fun with. What's the biggest challenge you faced in your life to this point, Tom, and how has that shaped the way that you do business?
The biggest challenges to me are family. But, if that's what you're talking about. And, my goal is I have 4 children and now I have 16 grandchildren. All of them are tied to the business one way or another. And they saw that I was successful and said, hey, how do I get involved a little bit, or their spouse? And that has been comforting because they're all doing quite well, actually. And that's nothing, I didn't ask them. They just wanted to do that because they could see that it was something I enjoyed. But I think getting a family to stay together is probably your biggest thing, and handling that. And then especially when you have diverse views, on politics and way of life. I said, we've decided a long time ago to, my wife and I, probably as my best advisor, is, hey, we need to spend time with every grandchild individually and see what we can do to help them about life, and talk to them, and take them individually. And so challenges are family things like that. Business-wise, my biggest, probably my biggest thing that I didn't know was happening, I was drafted when I was 18, the Vietnam War, and I didn't know it was going to happen. Everybody else I'd played football in high school and was going to play football at junior college, and I played tennis, and I was drafted, and they said, who has gone to college? I think 7 of us raised our hand out of 90 guys, and they said, who has played college sports? I was the only one. They made me the commander of the 90 guys. And I thought, I'd never been in leadership before in my life, really, from that standpoint, and a lot of them are older than me. And I thought, that was probably the most challenging for the first few weeks because I had no idea what to do. The same thing happened to me. I got hired when I decided to get into the computer business. I went to work. I ran for small dealerships, and a guy named John Rayfield, who just passed away, and Phil Verton were looking for a regional manager for Toshiba. 1984. They had one product at that time, a printer, and they ended up hiring me. And I had one employee, and I had to fire that employee after the first 2 weeks. They asked me. That was interesting challenges because I had to face things I'd never done before. Both of them turned out to be wonderfully successful. I found out in the service that I was really good at math because I wanted to be a helicopter pilot, and they wouldn't let me be a helicopter pilot. Because they said I scored too high on the math test, and they put me in nuclear missiles. And that pulled me. I didn't go to Vietnam. I didn't get in a helicopter, which 50% of them shot down, so divine intervention. And math has always been my strong point. Toshiba, after a couple of years, I was doing wonderful, and they put an industrial psychologist with me for a week, and they wanted to see how I managed, and a major consulting firm. And after a week, he took me aside and he says, you're a micromanager. I said, what? I'm not a micromanager. He goes, yes, you are. He said, when you're with a group of people and you ask their ideas, you do a good job. He says, but then you tell them what to do when you get done. And I said, well, isn't that what a manager does? No. And they changed my way of thinking of how to delegate. And he said, if you'll just take the ideas, and when you hear an idea that's just like yours or really good, you'll say, I love that idea. Can you do that? Can you make that work? Yeah. And tell the person to go do that. It's their idea. They'll do everything in the world to make it work. And I went from a micromanager to a delegator. And that's how I've run my life ever since, and been way more successful because I find people that value what they do. We agree, and they're willing to do anything to be successful because they told you they could do it.
I've had similar experiences earlier in my career, and I couldn't agree more. And that shift from the micromanager to the delegator is an absolute game changer in business and in life. we're on the same page on that one. All right, Tom, we're gonna finish here with what we like to call the lightning round. So what I'm gonna do is I'm gonna just give you a question, and I want you to just give us the first answer that comes to mind. You ready?
Yes, sir.
All right, we'll start easy. Coffee or tea?
Neither.
Neither. Okay. Cats or dogs?
Neither.
Okay.
Actually, dogs.
Dogs. Okay. This one's right up your alley, so I'm interested to hear your thoughts on this. What's one tool or technology other than your computer or phone that you can't live without?
My golf cart.
Your golf cart. All right. I love that. Do you have a customized golf cart, Tom?
2. I have one in Wyoming, and I have a Jaguar down here.
All right. I love it. I love it. I would love to check that out sometime. You're going to have to send me a picture of that. All right. Favorite quote or phrase about money or success?
You know, John Rayfield taught me one thing about people. Don't fix the blame, fix the problem.
Okay. I love that. Love that. Favorite book on finance or business?
Favorite book on finance or business?
Okay.
Don't have an answer on that.
Do you have a personal productivity, finance, or business hack? So some sort of like best practice that you utilize.
Spend less than you make.
Okay, love that. One bucket list item that you've already accomplished.
I would say I wanted to play Muirfield in Europe, and I got to play that a couple of years ago. I played almost every golf course except Augusta and Pine Valley in the world that I wanted to play.
Okay. I'm going to go off script here then. What's your favorite golf course that you've played?
No doubt about it. Royal Dornoch in northern Scotland.
I've heard great things. And have you been to Augusta?
No.
Okay.
I only want to go.
I've been.
Have you been?
I've been, and I've played
Garvey.
Pine Valley, so I'm lucky from that perspective. I haven't played Augusta, but I've been to the Masters, and I've played Pine Valleys. Those are treats for sure. Those are treats. What's one financial milestone that you're still working towards?
Private jet.
Okay, I love that. What's one financial?
That would never happen.
That's okay. Keep pushing. What's one financial mistake that you've seen turn into a valuable lesson?
Don't buy stocks on leverage.
Okay, love that. Love that. We often have to advise our clients on that. And then you may have already given it, but if you could give one piece of money advice to your younger self, what would it be?
Start saving and putting money aside earlier.
Yep, that's a common one for sure. All right, that's great, Tom. And then finally, if our listeners want to connect with you, want to get some information on your firm, maybe there's an aspiring agent out there that wants to learn a little bit more about your agency, where can they find you?
I'm a simple guy. I have lots of phones, but only one. They can reach me at 760-413-9749, 760-413-9749. Call me or text me, or caressinsurance.tom@gmail. And I answer every phone call and every text. I'd be glad to help anybody, whether they want to work for somebody else. I'll just give them advice. I'm to the point that I've been very blessed, and I don't mind helping other people. And I've had great mentors in my life, and I've been willing to help other people.
Very cool, Tom. That's a great perspective to have. Appreciate you sharing the personal info. If you're okay with it, we'll put that in the show notes as well. This has been great, Tom. Really, really appreciate your time today. Thanks for sharing your time, your insights, your stories, your lessons with our group. So this has been another episode of the Making Sense of Your Money podcast. This week with our guest, Tom Caress. Tom, thanks for being with us.
Hey, thanks, Dan.
Appreciate it.